Good morning, Kim. Today we have a lot of hot topics.
Hot surely it is. Today we're going to talk about the different disorders. First, the disorders of the nerves and the disorders of the spine. To discuss to us the different disorders of the nerves, we have Ms. Delmalyn and Rouschelle.
Thank you, Kim. Hey everyone! After Miss Kim introduced our first topic, me and Rose will tackle about the disorder, specifically the nerves.
Yes, we will talk about Guillain-Barré syndrome.
Oh, really? That's interesting.
Exactly. Did you know that it was named after two physicians, George Guillain and Jean Barr, who diagnosed two soldiers?
Oh, really? It's nice to know. So, without further ado,
Roll VTR.
A patient who is diagnosed of Guillain-Barré syndrome may need to stay in hospital for several weeks or months. Georges Guillain and Jean-Alexandre Barré diagnosed two soldiers with the illness and described the key diagnostic abnormality of increased spinal fluid protein production, but normal cell count. We are now looking at the pathogenesis of GBS. In stage 1, lymphocytes migrate through endoneurial vessels and surround nerve fibers, but myelin sheath and axon are not yet damaged. In stage 2, more lymphocytes extrude and macrophages appear. Segmental demyelination begins. However, axons are not yet affected. In stage 3, multifocal myelin sheath and axonal damage, central chromatolysis and nerve cell body occurs, and muscle begin to develop denervation atrophy. While on the stage 4, extensive axorial destruction, some nerve cell bodies irreversibly damaged, but function may be preserved because of adjacent less affected nerve fibers. Now, we are looking at the clinical phase of the disease. As you can see, in clinical phase,
Thanks, Sam. It was a very informative video of Guillain-Barré syndrome. But hey, Janine, did you know that aside from GBS, there is still a disorder of nerve?
oh really?
Yes. And what we got here is Perez nerve damage and diaphragmatic paralysis.
Oh, that's a long name there.
Yes, it is. Yes, it is. And I guess we should let the viewers see what we got here about this disease.
Yes, it is. So let's take a look and learn of what it is.
This picture shows a computed tomography scan of the chest in the ventral decubitus position. Note the homogeneous opacities in the lung bases, which are consistent with areas of pulmonary collapse, probably due to hypoventilation. Diaphragmatic paralysis is a common condition. It can be unilateral or bilateral, and the diagnosis is usually based on the clinical and radiologic findings. Bilateral diaphragmatic paralysis is usually symptomatic with dyspnea and acute respiratory failure, while unilateral diaphragmatic paralysis is typically asymptomatic, and when present, symptoms usually depend on the presence of underlying pulmonary or neurologic disease. Diaphragmatic paralysis can be the result of various chest conditions that
Let's go to spinal cord disorders. Jaycee and Ferds will tackle about this topic. Jaycee and Ferds, tango.
Good morning everyone, I'm Ferdinand and this is Jaycee Peleglorio. For spinal cord trauma may result from direct injury or indirectly from disease surrounding bones. Its causes are the following: assault, fall, gunshot wounds, and industrial accidents. So for treatment of spinal cord trauma, we have surgery and administration of corticosteroids. We administer corticosteroids to reduce the swelling. So for direct injuries such as cuts, cuts can occur to the spinal cord, especially if bones or the disc have been injured or weakened. So for symptoms of spinal cord trauma, we have increased muscle tone, numbness, sensory changes, and paralysis.
Spinal cord is a myotrophic lateral sclerosis, which means A, no, myo means muscle, trophic means nourishment, E means no muscle nourishment. Lateral identifies the person's spinal cord, and sclerosis meaning hardened. To further understand what is ALS or amyotrophic lateral sclerosis, let's watch this video.
All voluntary movement in the body is controlled by the brain. Nerve cells in the brain, called upper motor neurons, initiate movement through the release of chemical signals called neurotransmitters. The signal is passed from the upper motor neurons to the lower motor neurons of the spine. Nerve fibers extending from the spine, called axons, extend into the muscles. The point where the axons and muscle fibers connect is called the neuromuscular junction. When the signal reaches the neuromuscular junction, it causes the muscle to contract, resulting in voluntary muscle movement. Amyotrophic lateral sclerosis, ALS, often called Lou Gehrig's disease, is a degenerative disease of both the upper and lower motor neurons. As more and more motor neurons become affected, they are unable to send signals for movement to the muscles. Loss of voluntary muscle movement and coordination develop. Over time, muscle weakness and spasticity develop. Patients are unable to perform routine activities, such as walking and getting out of a chair. Eventually, paralysis develops, interfering with the ability to swallow, talk, and breathe. Unfortunately, there is no cure for ALS. Death from amyotrophic lateral sclerosis usually occurs within 3 to 5 years from diagnosis.
Three months ago, Richard Fussell was having a hard time staying on his feet.
I find myself catching my foot as I go upstairs. 2 or 3 times a day I'd trip.
Fussell was also having problems with his neck.
Pull up. Push down. Okay.
Orthopedic surgeon Dr. John Carbone suspected Fussell had a condition called cervical myelopathy, a degenerative disc disease.
Narrowing of the spinal canal leads to a compression of the spinal cord in the cervical spine or the neck region. That leads to motor dysfunction.
In 2006, Dr. Carbone operated on Fussell's lower back because he had lumbar spinal stenosis.
Came in with excruciating leg pain and weakness. When I did a neurologic exam on him, I was quite surprised to find, even though he's quite fit, that he had an unstable gait.
At that time, Carbone warned Fussell he may need a second surgery for his cervical spine. His neck and balance issues were related.
He said, you know, you can rest all you want and you can have as much therapy as you want, but likely you'll never solve this problem. Your spine is closed up. He said, if you want to play tennis anymore, and I also ski and kayak, he said, you're going to need to solve this.
12 weeks ago, Carbone operated on Fussell's cervical spine.
We were quite lucky in that he neurologically completely recovered his balance and his fine motor skills. He no longer trips, and he has a complete resolution of the leg pain that originally brought him in.
Richard Fussell is back playing tennis and nearly as good as new.
I wanted to maintain my lifestyle, and it was very important to me. The stumbling is gone. The pain is gone.
Kelly Swoop, to your health.